Good afternoon, everyone. I'm Dr. Sarah Mustafa from DentistChannel.Online. Welcome to today's webinar about the parameters of smile design in a simple way. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It is your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first-hand information on the technological advancements in the dental field. Now it's time to start the session about the parameters of smile design in a simple way. If you have any question about this topic, please feel free to ask it in the question and answer box, and we will answer each and every question at the end of the session. I will start by introducing today's session speaker, Dr. Yasser Al-Alawi. Dr. Yasser graduated from Uruk Private University, Baghdad in 2018. After that, he completed a professional diploma in aesthetic dentistry by the British Academy of Implant and Restorative Dentistry. He is interested in the restorative and aesthetic dentistry field, and he currently works in Perfect Solution Dental Clinic in Baghdad. Welcome, Dr. Yasser. It's our pleasure to have you with us.
Thank you.
You can start sharing your screen now.
Okay. Hello, everyone, and good afternoon. Thanks, Doctor, for introducing me. Today, we will talk about the smile design in simple way, which means how we make and design a perfect smile with a simple principle, simple parameters that assist in our work. First, to a CV for me. I'm graduated from Uruk University, and then I joined the British Academy for a professional diploma because nowadays the aesthetic or restorative dentistry is our main branch in all dental clinics. And I work privately in Perfect Solution team in Baghdad. First of all, the patients come to us, to our clinic, to make a natural, perfect smile. First, we will we will look for the symmetry of the face and the symmetry of the upper, middle, and lower halves of the face. The eyebrow line, the interpupillary line, all these give us an indication for the symmetry and how we make the smile. Our smile is equal to the face in general. Our guidance in the facial midline is the facial midline, not the dental midline, which means when we make or design a smile, the guideline of our dental midline is the facial midline itself. So we don't obtain the midline from dental, no, from the facial midline. Some studies, and many of them, shows that 70% of dental midline is equal to the facial midline. So it's a big percentage of symmetry. But the same studies show that 75% of upper midline don't coincide with the lower midline. So we don't need, in most cases, we don't need to make the upper midline is coincide with the lower midline. It's enough to make the upper teeth midline is equal or coincide with the facial midline. But there are some problems we can face in the midline itself. So it's maybe a small thing in the midline, but there is some problems that make the smile design is hard and make the design maybe sorry and make maybe ugly the smile design if we don't solve it. It is the sorry it's the midline shifting and the midline canting. The midline shifting, which means the shift of the midline either right or left, but shifts up to 4 mm, which means 1, 2, 3, 4 mm can be acceptable, and the eyes can show it, look it as a accept. But the canting, which means incline of the dental midline, right or left, can be noticed as little as 0.5 millimeter. That is the shifting, which means the midline is shifted or moved completely to the right or left. And as we said, the eye can notice more than 4 mm, but up to 4 mm can be acceptable. Such as the actor Tom Cruise. He has a dental shift midline, maybe up to 4 mm, because most of the people doesn't notice that he has a midline shift. But the canting, as you look for, which mean inclination of the dental midline or the upper dental arch, either right or left, but maybe 0.5 or 1 mm can be noticed. And and if we doesn't note that in the smile design, the design or the smile, the whole smile will be errored or ugly. After we look for the symmetry in our smile design and the midline to coincide with the facial midline, we will talk about the dental proportion of teeth. There are golden and red proportion. We mean by proportion is the proportion of size or volume of the tooth to another tooth, which means the proportion of central incisor to the lateral incisor and to the canine, to the premolar, and all. The golden proportion for these, which mean 70% to the 75% to the 85% is the proportion of centrals to the lateral and to the canine, which mean 75% of the central, the height, and is the proportion of the height to the width of the tooth, and the proportion of central to the lateral. But the red proportion from 90 to the 110%, which means is the width of the tooth is more than the length. So the tooth will be either square or triangle. Then we will talk about the golden proportion of the tooth itself, which means the proportion of central to the lateral to the canine. The teeth in general, the central is bigger than the lateral, and the canine is bigger than the lateral. So we, when we design the smile, we consider that the central incisor is 1.6, that the volume or the size or the lateral of the lateral incisor, and 0.6 for the canine. which means the canine in proportion is more than the lateral incisor with in 0.6, but the central is 1.6. So when we design, it considered to the golden proportion of the teeth itself. Incisal length. Incisal length means that the incisal edge that shows when the lips or the patient is at rest position, and we can obtain it by make the patient say M letter M. That makes the incisal edge show as at the rest position. Normally, it shows at about 0.5 to 1 millimeter in most of the people. But incisal length depends on many factors: age and gender. Younger patient shows more than the old patient, because the patient, when he become older, there is maybe attrition in teeth, then result in decreasing the length of the teeth. So there is no incisal edge or incisal edge show at the rest position. And the gender of the patient: female is more showing more than the male in rest position. The incisal edge, the length and curvature of the lip. Maybe the patient with high lip or big lip, the lower lip may be bigger than the upper lip, so it will blocks the incisal edge showing at the right position. The smile line of the patient, which means the curvature of the lower lip, and the function of the teeth. That's many factors that result or depends on the showing of the incisal edge. The buccal corridor, which means the negative space between the upper posterior teeth with the cheek. That space give us indication, which means if too much big, the negative space or the dark area become too much, will give us a denture look, a look that the patient wearing a removable denture. Or if it not enough, which means we bulk the upper posterior teeth buccally, will make us look at the patient, and we suggest that he has a missing tooth look. So we must or we should give the negative space not too much or not enough for the smile in general, because either give us a denture look or missing tooth look. Axial inclination of the teeth. The teeth in general, it's not straight. No, the axis of the tooth is inclined. So the centrals is the axis of the centrals is straight, but the when we go posteriorly, the axis of the tooth is inclined distally, such as the laterals and canals. The canine, the axis of the tooth in general, from the incisal or occlusal to the root, is inclined distally. So when we make a smile design or a smile in general, we consider that the axis of the tooth is not straight, because if we make it straight, we'll give a straight smile line, not a positive smile line, and we will talk about the smile line. So the central incisors are parallel to each other. Laterals 5-degree distal inclined, but when we go posteriorly to the canine, more than 10-degree inclination distally for the canines. And when we go posteriorly more than canine, premolars, molars return to the parallel to each other, or return to the straight straight axis of the teeth. Contact area from centrals and when we go posteriorly from centrals, it's a contact area, and when we go to the posterior area, it reduces from contact area to contact point. So when we make a smile, we should give attention to the contact area, because it's more important. The most important thing is in our smile design. Why? If we make it tight contact, which make food impaction between teeth, and the patient can't clean it with floss, because he will face a problem and enter the floss in contact area because it's tight, and the patient maybe don't clean at all when he show there is a problem in cleaning with floss. And if we make it with a space, not ideal contact area or contact point, the food impaction will be easy. So we will enter in a problem or a new problems with the gingivitis or periodontitis or anything. The central contact area, 50% from the length, which means the contact area between centrals and mesial aspects contain about 50% from all the length of the centrals. Central and laterals contact area. Centrals and laterals contact area form 40% from the length. So the contact area between central and distal side with the mesial side of the laterals form the 40% from the length of the centrals and laterals. But the laterals distally and the canines mesially, the contact area between them forms 30% from the length of the canine and lateral. And when we go more posterior to the premolars and molars area, convert from area to the point, which means contact area convert to a contact point, a small point of contact. Embrasures, which mean the divergence between teeth, between the incisal edges of the teeth. To make it the patient look younger, you must or you should make the embrasures wide. This will give us the look of young patient or young patient smile. So when become wider, the embrasures, and the patient at all with a new smile become younger. And when we go posteriorly or more posteriorly, the embrasures increase in size. The zenith point. Zenith point is more important because the axis of the tooth depends on it. The shape or symmetry of the gingiva or the cervical area of the tooth depends on it. Zenith point, which means the most higher point of the gingiva of the tooth. The zenith point, as you look at the screen, the most higher point of the tooth, the central incisor, or the zenith point of central incisor, locating more distally than the center of the tooth. Central and canines, the zenith point of central and canine is located distally, but the lateral and middle. So when we look at now, as you look at the central incisors and the canine, the zenith point of it located distally, which means like this. So the axis of the tooth, or it followed the axis of the tooth, but the lateral in the middle, like this. So this is the ideal when the patient comes for ideal zenith point, or the comes to decrease the gum smile, and we do either surgical crown lengthening or aesthetic laser assisted gingivectomy. We should make the zenith point of the centrals and canines look at the distal side slightly, and the lateral incisors in the middle. The gingival line, which means the height of the gingiva of the tooth in general, one to the another, which means the central incisors, the gingival line is higher than the lateral incisors and about 0.5 to 1 millimeter. Same at the length, the gingival line of the canine. So we have 3 types of gingival line. We have the ideal gingival line, which means the central and canines equal and 0.5 to 1 millimeter higher than the gingival line of the canine. But we have another type is the acceptable. If we can't obtain the ideal gingival line, we obtain the acceptable gingival line, which means all the centrals, canine, laterals are equal in the gingival line. But there is unacceptable gingival line, which means all the teeth, maybe the centrals itself, the right and the left central incisor, are not equal. So in smile design, or when we decide to make a whole smile rehabilitation or smile makeover to the patient, we should equalize the canine and the centrals and make it higher than the lateral incisor, either by surgical crown lengthening, or laser assist gingivectomy, or aesthetic gingivectomy or gingivoplasty, to give it a natural look, to give it an ideal look, because we don't deal with white, I mean the teeth itself, but we deal with the soft tissue. The soft tissue is our issue in smile makeover, because you and the technician, you may make a natural teeth, a natural veneers, a natural crowns, very beautiful crowns, but you don't pay attention to the soft tissue compatibility with your crowns. You may invade the biological with hurt the gingiva, and your work will be failed at the end. Now we will talk about the smile and lip line, which mean the curvature of the teeth according to the curvature of lower lip. We mean by the smile line, there are 3 types: positive, straight, and negative. We mean by the positive is the curvature of teeth, which mean when we go posteriorly, the teeth decreased in length. So we will obtain a curvature of the upper arch, dental arch, and is equal to the lower lip. That is the positive smile line. The straight smile line, which mean the centrals and other teeth are at the same level, not equal to the lower lip, like this. And the negative smile line, which means that the teeth posteriorly is taller than the anterior, the teeth in anterior area, which mean don't equal to the lower lip, and the molars, the cusps of the molars and premolar is taller than the cusp of the canine and the incisal edge, and this will make an ugly appearance to the teeth. We have many factors which is we consider in our smile design that makes a reducing aging effect on smile. For example, patient, a 65 patient or 60 years patient come to our clinic to make a smile makeover. We need to make a perfect or natural smile with reducing agent, which mean in the result, the 60 years patient enter the clinic and he will left our clinic with a new smile and a new age, which mean from 60, we maybe make him a 40 years or 30 years effect, by which, by the shade. If we choose lighter shade, this will give us an reducing agent effect. Then make the teeth longer, not longer more than the natural proportion, but we will focus about the golden proportion of the teeth and the dental proportion, and an increase in embrasure size, as we mentioned before. If we make the embrasure area wide, it will give us a young look to the patient when he smiles. So these three factors will affecting, and this I make it in all cases with all patients. I choose the lighter shade. I make I pay attention about the golden and dental proportion and increasing in the embrasure area. Now we will talk about talk about the dental shape or the tooth shape, and small informations to know that our teeth is not the same. So maybe a patient come to our clinic with a rectangular shape of the teeth, or with oval or rounded shape of the teeth. So every patient has a treatment plan, and all ideas for the smile makeover of his case. In the rectangular shape, the centrals are dominant, and the incisal edge of the incisors and the laterals are flat, not rounded, with aggressive cusps of canine and premolars, and the axis is vertical or straight of all teeth. But the oval in shape dominant centrals, and this oval or oval shape of the teeth which is more in female than in male. Rounded cusp of all teeth with a delicate laterals, which mean the laterals are more rounded and the arch is rounded in general. And the triangular, the smile line and the smile line is equal to the lower lip converging axis, which mean we have these axes. We these converge axes, not diverge axes that we look for the as we mentioned for in the smile design, and an inclined cusp, which mean the canines look at an inclination, the cusp of the canine inclined. And the square, here in square we can't obtain the golden proportion of the teeth or dental proportion. Why? Because the teeth shape as a square, which means the length of the teeth maybe it's equal to the width of the tooth. Lack of dominance, which mean the central lateral canine are in the same arch or in the same curvature of the arch, diverging axes and horizontal arrangement. As we mentioned, there is a lack of dominance between teeth. Nowadays, we have a new thing. Before, we don't have the digital smile design. Before, we have the conventional wax up or the conventional smile design, which mean that we do a conventional wax up on a cast, and this is the smile design. Nowadays, we have the digital smile design, which mean in my clinic, when the patient come to my clinic to obtain a new smile like this, I take photos for the patient and measure the distance between centrals from the distal side of the lateral of the left central and to the distal side of the right central. On the patient mouth, and make it on the on the software, and that the measures from the patient mouth, and I will do or apply all the smile design parameters that we look we talked it before on the software. So I make an oval shape of the teeth, the new one. I consider that I apply the golden proportion of the teeth between central lateral canines and the dental proportion of the tooth itself. I talk about the length and width. Then I make this the design and show it to the patient in the same visit, and make the patient look at his final state. So when the patient look at his smile before you touch his teeth or her teeth, the patient will has a trust in you and trust in your work, because you showed his result before you start the work. This patient is about 50 years old, come to my clinic and told me, "Doctor, I want, because I can't smile, and I ashamed for the smile, and all the time I wearing a facial face mask." So In the beginning, we begin with photos, a smile design, a digital smile design, and I showed her a smile, the final smile before I touch. She accept, make this smile design, the simple idea. You will make it before the work with either with all patients. Make the patient happy, especially these patients that are ashamed of smiling to the people. So when she saw her smile, uh, told me, doctor, start and do what you are want to do. The important thing is I have a new beautiful smile. So we began with the endo treatment and the restorative treatment, and then with the indirect restorations, and we have this smile. The patients, the case of the patients or the situation of patients required a surgical crown lengthening to equalize the gingival line of the teeth, the zenith point of the teeth, but the patient reviews the surgical work. So so this lateral incisor left, the left is not equal to the right, and the gingival line in general is not acceptable, but the patient is happy with their new smile, and this case is followed up for 2 years or 2.5 years. This patient come to my clinic with an occlusion problems he has, because all the occlusion anterior, and there is a space posterior, and looking for either for all function and aesthetic. So in the beginning, we must restore the function of the teeth, because we deal not with a dental, we deal with a TMJ and muscles. So we restore the function of the teeth, then the aesthetic. The patient teeth situation is okay, so we go to the veneers, Emax or lithium disilicate veneers, in conservative way, by a mock-up preparation. So we restore the occlusion of the posterior area by the tabletop or occlusal overlay or occlusal veneers. Then we restore the upper and lower anterior area by the Emax veneers. Then this is immediately after cementation. From this to this, we restore function, as it you see the posterior area with Emax or occlusal veneers, and we restore the whole smile and its relationship with the face symmetry and the beauty of the smile, that's effect of the on the beauty of the face. That is the smile after follow-up about 1 year. This patient come to my clinic, 35 years old, told me, doctor, I have an ugly smile, I need to restore it, but I need a very natural shade of the teeth. I need a natural smile, not a light shade. So in the beginning, we do the restorative part, fillings, endo, and she has left central incisor with a ceramic or porcelain infused metal ceramic crown. We removed it. We restore the bases of the teeth and make it good, or make all the teeth is now able to receive a new crowns, and this is how we obtain the new smile with a new shade and new shape of the teeth. And that's we talk about the positive smile line, which means when we go posteriorly, the teeth are decreased in length and equal to the lower lip of the teeth. This is a very challengeable case. It takes from me about 8 months or 6 months. The patient come to clinic with this situation of the teeth, and the soft tissue. As we mentioned, the soft tissue is our issue. We must, not should, we must solve and make it the soft tissue of the patient healthy. Then we turn to the white or the teeth of the patient. The patient come to us with a severe gingivitis due to defective fillings, due to overhang composite fillings of the anterior area, and he wants not aesthetic, to restore the function of the posterior teeth. We do a dental implant for the posterior or the missing area, and we restore the health of the gingiva and the soft tissue at about 2 months by instruction the patient about the oral hygiene instructions, and make it a scaling, a deep scaling and polishing of the teeth with laser assist gingivectomy and gingivoplasty, and prepare the teeth and make a PMMA, temporary crowns, for about 2 months, and we obtain this situation in the end, natural as can we get. The gingiva, as you look at, healthy, pink, not bleed, and the patient when I talk to him, your success of your case is depend on you by the instructions of the oral hygiene. The patient was educated, so return to me, and he's 100% apply my words, and in the end he get a healthy, natural, beautiful smile, healthy, natural, beautiful smile makeover. And this is the photo after 3 months follow-up after the case delivery. And then we will talk about small things that affect on the smile of the patient. Patients come to me and say, doctor, that my smile, I don't like it. I don't like smile because my tooth and the is the central incisor, the right side. I don't like it. He is make me sad, and when I smile, replace it, extracted, make a dental implant. I don't like it. In the end, I make a small, and that's the result. The result is the left central incisor, make it a small filling, a small composite filling to restore the shape of the tooth, and in the right central incisor, I remove the old crown, the old porcelain crown, full jacket, and I do endo treatment for the tooth, because there was a lesion, periapical lesion in the tooth, and put a fiber post to give it retention, because there is a little furrow, and make a new Emax crown and then you see this tooth affect the whole smile. So when we pay attention about a small things in our smile or in the patient's smile, we can make a more natural smile by solve these little things. So this is before and this is after. In the end, the smile design is mandatory in our indirect work, or in our smile makeover, or in our full mouth rehabilitation cases. Why? Because many errors in our work or in the final works, we can edit it and resolve it at the smile design and the patient. We will give a trust to the patient to work with us and make our trust in the patient, and the patient gives us a trust that we will work in his or her teeth. And make us the smile design is very important in the preparation stage of the teeth, because give us indication about the area that require a more a preparation than another area. So as an advice from today, when a patient come to your clinic to make a smile makeover, to do a full mouth rehabilitation, first of all, take a photos to the patient, make a 2D smile design, make a 3D smile design, and show it to the patient in the same visit or in another visit, the photos of 2D and the mock-up of the 3D design. This will result in natural smile and perfect smile, because all of us is looking for a perfect work or perfect result that makes our work professional. So we talked about small things that assist us in the smile design and the principles of the smile design. So I complete the presentation. If you have any question about the smile design in general, or anything that we talk about, write it in the comments to answer it, and the all show.
Thank you, Dr. Yasser, for this informative session. So meanwhile, I'll ask your permission to introduce our company to all the participants. And okay. I request all the participants to kindly put their questions in the question and answer box. So this is our company, DentistChannel.Online, Healthy Smiles, Wealthy Lives. DentistChannel.Online is India's first digital dental media company. We did webinars and courses with more than 400 national and international speakers, many successful world implant expos, and much, much more. If you're not a Prime member yet, kindly join our family to get free certificate of participation after every event and get exclusive offers and discounts on our online and on-site paid workshops and courses. Most importantly, Prime members will be awarded with 1 CPD-CE point for each free webinar. You can use my code SAR100 in order to benefit from a discount and get the Prime membership for $9 per year. This is an example of the certificate of participation that you will get after every event. About our upcoming webinars, tonight at 9 p.m. Indian Standard Time, we have another session with Dr. Juan Acosta about communication, communicate to win, how to bond with your dental patients. Tomorrow at 9 p.m. Indian Standard Time, we have a session with Dr. Salam Harfoush, the basics of mastering ceramic veneers preparation. On March 27, we have a session with Dr. Kado. She will talk about maxillary sinus lift procedures. And another session with Dr. Rhea about oral hygiene in orthodontic patients. About our online master classes, we have one happening tomorrow from 10 a.m. until 1 p.m. Indian Standard Time with Dr. Jaina about communication, the key to a successful dental practice. I request all the participants to kindly save this number and then send a message on WhatsApp with their name so they will be added to our broadcast list and they will receive everything about our upcoming dental webinars and courses. Today's webinar is sponsored by NovaMind. NovaMind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implants types called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solutions produced maintaining all the standards of EU medical device regulatory. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restoration. If you want to know more about NovaMind, kindly check their website. And last but not least, don't forget to follow us on our social media platforms, Facebook, Instagram, and YouTube. Okay, so now we can do the question and answer session. Dr. Deepu is asking, is the setup for cosmetic dentistry different from the routine dental practice in your dental hospital?
Sure, doctor, because in the routine dental hospital or the work in the government hospitals, the patient doesn't come to the dental hospital or the government centers and want to make a smile makeover. All the dental routine in the dental hospitals come to make the endo treatment, the fillings, the functional fillings in general, not the cosmetic fillings. So in your private work, the cosmetic setup is different from your routine dental practice. And the other question?
Yeah, he's also asking, do you advocate any muscular deprogramming devices for all cases?
For the muscular deprogramming devices, such as Lucia Jig, not all for all cases, because maybe we use it, and I use it for the cases of full mouth rehabilitation, when I must or I should restore the dental occlusion or the occlusal centric to the centric relation of the TMJ. So I use the deprogrammer and the semi-adjustable articulator to make an occlusal adjustment and make the occlusion in class 1 and in class 1 and the centric occlusion with the centric relation of the TMJ.
Okay, doctor, that's it. We don't have any other question. I would like to thank you for sharing your knowledge and experience with us, and we are looking forward to organizing more webinars with you in the future, inshallah.
Inshallah.
Thank you, doctor. Thank you, everyone, for joining us. Thank you. Bye-bye.
Thank you.